Good day, fellow colleagues. I am Ricardo Kevin Warner, first year student attending the University of Trinidad and Tobago, currently undertaking a course in the Masters of Public Health and Administration. Today, I would like to discuss with you a phenomenon that currently exists within the work environment at a local health center. The phenomenon or the problem that we are going to discuss is community acquired infections. The epidemiological problem that we are going to discuss today is the occurrence of healthcare associated infections at the community health center. Many community health facilities are faced with these infectious diseases which are related to either poor environment, poor asepsis techniques, unavailability of infection control policies, and the cross-infection by clients or patients accessing the health facility. Some may ask, why is this a problem, or why should a problem like this exist at a health facility? This is seen as a problem merely because it affects both staff and clients attending the clinics. The staff are affected because they develop complications that are related to upper and lower respiratory tract infections. As it relates to the clients, like those attending the child health clinic or the antenatal clinic, it predisposes them to different community-acquired infections. And as such, it increases the burden of health on the nation. I'd like you to turn your attention to the photo on the screen. This photo depicts the wound care department. Within the department, you will see two bunks close to each other. Separating the bunk, you will see a blind. And as you look further around the room, you realize that there is one sink that is actually designed to be a sluice sink, but also has soap dispensers, which also facilitate the hand washing process done by the staff. To your extreme right of the picture, you'll see a small window and cupboards located in the room. The whole location or layout of this room does not provide for the prevention of healthcare associated infection. It is important to know that clients access this clinical area between the hours of 8 and 12 during the day, Monday to Friday. How can we fix the problem? The problem could be fixed from a three-pronged approach: restructuring and designing of the department, 2, relocating the department entirely, and 3, the introduction of infection control policy. The restructuring of the department will require the removal of one of the bunks, which will allow for one client to be seen at a time in a more spacious environment. The installation of a hand washing sink will also be a need, since this will reduce the risk of cross-infections by the staff. Relocation of the department on a whole to a more suitable spacious area that will allow for 1, comfort of the patient, 2, well-ventilated area, 3, relocation of the wound care department to a more spacious and suitable area will be the best solution, since this will provide a more therapeutic environment whereby patients will be more comfortable, more space will be available, and the proper environment will be created as it relates to wound care. A key factor that can be viewed as essential in fixing this problem is the development and implementation of an infection control policy. This policy will guide the practices of the staff and also allow clients accessing the unit to be fully aware of the proper procedures and precautions that should be taken while accessing care in the home care department. In addition to the aforementioned recommendations, we can also look at other preventative measures that can be used in ensuring that these infections are controlled to a point where it does not cause an outbreak or an endemic within the department or within the healthcare facility. It is important to know that sensitization of your stakeholders through the education process, and that is what we call health promotion, where you educate both staff and clients on the said infection control policy that was developed. Intermittent, or what we'll call periodic swabbing of both staff and clients accessing the department. So in the case of staff, we'll look at swabbing the throat, that is both nasal and oropharyngeal areas. Swabbing of the client's wounds, either 3-monthly or half-yearly, or as the case may determine, and keeping proper surveillance of the results that the wound swabs would have returned. Developing policies within the health center that will enforce standards of performance as it relates to asepsis and aseptic techniques. As we come to the end of this discussion, it is important for us not to focus on the problem, but to pay particular attention on the necessary interventions needed as recommended to minimize or reduce the incidence, prevalence, and possible outbreaks of community-acquired infections.